Hello, everyone, and welcome to today's webinar. Today's webinar is called New in Your Role. We want you to keep calm and accredit on. I'm Lisa Silverman. I am URAC's client education specialist, and I'm here to facilitate what we hope is a really strong and good experience for you today. We've designed this webinar for those of you who are new to your role. Maybe you had accreditation handed down to you. Maybe you were involved on the periphery beforehand, and you're getting more involved in this next go around. So we are here to help you make sure you're feeling a little bit more confident when you leave the webinar today and answer some questions and introduce you to the people, tools, and resources who are here to support you. What we'll do today, quick welcome and introductions. We're doing that right now. URAC's President and CEO, Dr. Sean Griffin, will talk about URAC. Our Vice President for Accrediting and Client Services, Dr. Karen Watts, will go through the accreditation process. Joe Costello, our Director of Client Services, is going to show you the tools that we have to support you and to make your experience great. And then Maggie Cornett, our Chief Information Officer, is going to give a quick overview of AccreditNet. Here are the faces you're going to see on your screen starting in just a minute.
Hello, everybody. I'm Dr. Sean Griffin. I'm the President and CEO at URAC. I am Lisa's Robin to her Batman on many of these presentations.
So, Sean, we can see as part of the course for URAC and who we serve, we've got about a third of our group here is pharmacy. We've got pharmacy, we've got hospitals and health systems, got the standard players in the room, the health plans and health networks. You are IRO, IME, pick your favorite acronym in the healthcare world. We've got you in there. If you're something else, please share it with us in the chat box. So, for most of these people, it's not their first time going through accreditation with URAC. So it's good to know. So we're kind of going to give you the update. You'll hear about some of the changes we've made. Maybe there are things we've done that you didn't see the last time around. We're constantly improving services. And what makes you nervous? So it seems like the big thing there is making sure they have the right documents, followed by the on-site review. I see people, third-party CVO, case management in here too, correctional healthcare service providers, some friends that we've met along the way at some conferences we've been at recently. So nice to see everyone here. Sean, I'm going to stop sharing the poll results and turn the floor over to you to talk to the audience a little bit about URAC. You all know about URAC for the most part. It sounds like you've been with us before. So we'll go quickly through this to make sure that we can get through the important stuff, what's changed a little bit.
Absolutely. Thank you so much, Lisa. I'm going to talk a little bit about URAC. I just want to say thank you guys for carving out the time to get on this webinar with us. We really appreciate you. Accreditation is not supposed to be a trick. It's not supposed to be a gotcha sort of thing. So let me talk about how we view accreditation and the history of URAC here. So go ahead, next slide, please, Lisa. So URAC was founded back in 1990. We are a not-for-profit. We are independent. We see our role as validating quality throughout the healthcare landscape. One of the things that's really important about us is that we are probably the accreditor who worries the most about making sure that we have strong integrity in what we do. Therefore, we don't sell you consulting services. We don't think that if you're going through accreditation, you should have to pay for a bunch of consulting hours from the accreditor. We think that's a conflict of interest. We also don't control measures and sell measure sets and those sort of things, because if you own measures, you tend to stick them into your programs and make people pay for things twice. So we really say that here at URAC, being the most complete healthcare accreditor, we're going to be not for profit. We're not going to sell consulting services. We're going to have really clear and honest transparency with the things that we do. So if you buy an accreditation, you're going to pay for that accreditation service, and that service is going to be educational. We're not going to do any tricks, and our goal is not to have you be high quality the day that we show up. It's to set you up to be high quality every day, to serve the people that you serve day in and day out. Next slide, Lisa. So when we talk about accreditation, accreditation is more than regulation. The way we see things, regulation sets the bar for safety. Regulation tends to be the regulators, the federal government, the state government, those sort of things. But accreditation is really setting the bar for quality. When I was a physician, I would get my license from the state, but I was board certified, and that was the higher mark of greater quality that I chose to do when I was a physician. And to be accredited by URAC means that you're not just doing the bare minimum. You're not just getting by, but you're working with an accreditor who has been around for a long period of time and who really wants to make sure that you're meeting quality for all the people that you interact with. Next slide, please. Now, when we talk about accreditation, I've touched on some of these things before. Accreditation is not simply checking the box or buying the standards or those sort of things or paying enough consulting hours that somebody blesses the work that you do. It really is about equipping an organization to have a quality framework for all that they do. It's intended to ensure continuous quality improvement. We update our standards. We move people along. We don't just do the bare minimum. We're showing what is extra. And then it's independent third-party verification of a quality program. We're an independent organization. We're not an arm of a pharmacy system or a doctor system or those sort of things. We are independent. And since 1990, we have been just being about quality and making sure that patients get the best care that they can. And in some places, accreditation is required. It's you have to be accredited to do such and such thing. But in a lot of areas, accreditation is sort of that extra that I use the analogy, and eventually I'll probably get yelled at about this, but it's sort of the good housekeeping seal of approval. It's the Angie's List or Better Business Bureau. You're doing more than simply the bare minimum, and it makes we're holding you accountable for being more than just that. And leaders and people who want to distinguish themselves in the marketplace often use accreditation. So we were at Assembia recently, and if you went around to Assembia, some of the larger organizations had a plaque basically on their booth that says they are URAC accredited to demonstrate that they are doing more than the bare minimum. They're going above and beyond to make sure that their care is the best. And next slide, please. So when we talk about our programs, we have a lot of different programs. This is why we're the most complete healthcare accreditor. We have everything from, maybe you know us in pharmacy, and a third of our attendees we're sort of in the pharmacy space, but there's patient care management that has the health utilization management, independent medical review, administrative management, where you've got clinically integrated network, credentials verification, health and dental plan. We're Medicare deemed accreditation for the federal government program. But then we also have been innovators for quite a while. We do digital health. So we're the leading telehealth accreditor in the United States and across the world. We do remote patient monitoring. We do health website, health content. All of those things are really important as we look at where healthcare is going. And I want to be clear, we were doing telemedicine before the pandemic. We knew it was going to be big. We turned out to be right. We wish it was under better circumstances. But the thing is if you're doing a telemedicine visit, you want somebody to verify that the person that you're working with is actually a quality provider. And anybody can look good on camera. They can throw on the filters. They can put up the props, but that doesn't mean that they're doing good medicine. So if you're getting a telemedicine visit, we think that it should be an accredited provider. And then there's the mental health and substance use disorder parity that we've been doing for a few years now. And that's really recognizing the challenges that are going on in the world today around mental health care and substance use disorder treatment and those things. And we are the only organization that is doing a mental health parity accreditation. And we have a lot of insurers and payers who are looking at that and going, we recognize the challenges with doing this well. And we think that URAC's accreditation helps to give us a framework so that we do a better job of it. So that's a pretty broad suite of programs that you see there. And next slide, please. And that wasn't including our pharmacy stuff that we're most known for. Our organization helped invent the specialty pharmacy accreditation, and we're the leading accreditor of most of the organizations that you recognize. And I saw some really impressive names pop up in the chat for the organizations that you represent. But we do specialty pharmacy accreditation. We do rare disease center of excellence. We do mail service pharmacy, just among our leading pharmacy programs. And all of those things are incredibly important because we know that pharmacy is not just about counting pills and putting them in bottles, but you have these biologics, you've got these ultra cold medications that you need to take care of. And we're going to make sure that we're doing fantastic standards and you're practicing the best that you can be. And that's why our accreditation is recognized by all sorts of different payers and government agencies. And we're going to be doing updates on those programs coming up, and we're going to keep those things out there and keep them to be leading the way for what is high quality accreditation. I think that may be my last slide, Lisa. Let's see what the next one is and see if you hand it off. Oh, nope. I think I got this one too. Don't I have this one
You
too?
have this one and you have the next one.
Ooh, two more. Sorry about that. Uh, I sometimes lose track of how many slides I've talked through. So like I talked about before, the tenets of URAC accreditation is that it's an educational process. It's intended to be educational. You don't know what you don't know in the beginning of an accreditation process, and we're going to help to guide you, and our reviewers are absolutely fantastic with educating organizations and helping them to understand things. And we don't charge you for consulting when we do that either. It's the gold star of URAC is meant to demonstrate your excellence. Our reviewers have backgrounds where they worked in business. This is not people who don't know what a pharmacy is like, who don't know what utilization management is like. This is people who worked in healthcare, and the desire is to drive constant improvement. We want you to be better tomorrow than you were yesterday, and part of that is measuring the quality that you do. So a number of our programs actually have measures which are included in the accreditation. Now, maybe when you start off in the program, you're not doing measures, but as you progress, you start doing measures. And those measures aren't meant to be tricks or anything like that. That is to do measures so that you can compare yourselves to others. And we give out awards for high performers and leaders in performance measurement. And then we also give you a report as to how you're doing. And part of that is we use that measurement in a large part to help educate people about the value of accreditation, because people who go through accreditation, organizations that go through accreditation, deliver higher quality and higher value than those organizations that don't. And it's worth us trumpeting why that's important and why that's valuable in this day and age. And then next slide, please. So when you think about what we're trying to do, I'm going to start at the bottom here. We have our foundational principles, an educational approach to reviews. We're independent. We don't sell the consulting services. Our reviewers are URAC employed clinicians, and it's not like we pick somebody out of a hat and maybe they do 2 reviews for us in a year. These are people who they do all their time doing accreditation reviews, and our high quality standards developed by experts in the field. And this is pulling together convening organizations from across the country and around the world about what are best practices. And we are going to keep doing that as that's our commitment to going forward. But once you do those foundational things, there's also some things that we've updated over the past few years. We've had more affordable pricing. We've really worked to expand our client education tools, because sometimes you don't want to call. Sometimes you want to look up some things. You want to understand some things. Offerings for smaller organizations. I trained in rural family medicine, and one of the things that I said when I came to the organization is we want to make sure that smaller organizations can afford to be URAC accredited. So we have some small specialty pharmacy offerings and those sort of things, because we don't think that you just need to go to a major city to get the best type of care. And then we've increased our free education and training. This webinar, I hope nobody charged you for coming to this webinar, because we really think that this is part of the educational process, is to have webinars and to bring in the experts and to share client testimonials. We like to have clients come on and tell their stories, because we think that that promotes the work that they're doing. And as we continue to grow, we've worked on simplifying our standards. Our standards can sometimes get pretty complex, and we've tried to simplify them. I've joked with my team. I said, we need to make these simple enough that I can understand them, that there's not a bunch of jargon and a bunch of technical phrases and those sort of things where people can't understand what we're talking about. We've increased our partnerships. We're partnering with other organizations to help to open the door to accreditation for more and more organizations. We've tried to shorten our timelines for going through accreditation, because if you sign up for an accreditation and it takes you 6 years to get your accreditation done, by the time you get to the end of it, you forgot why you started in the first place. So we're trying to get our accreditations simplified and shortened and down to a more reasonable time period. And then we're always looking for what are some of the emerging things going on in healthcare, so that we can have programs that help those sort of trailblazers to step into that space. I think that's my last slide. I did see some things pop up, but I see answers coming up in the chat. So Lisa's come back on to rein me in now, and I'll turn it back over.
That is, and we're going to turn it over to Dr. Karen Watts, who's our Vice President for Accrediting and Client Services. Karen, I'm seeing in the chat a couple of questions about core and our change from core to foundational focus areas. So I know that's really your area, and hoping you can address it. And then somebody asked about the validation review. So we actually, Karen, you're going to talk about that in a couple of slides, but we also have a couple of our reviewers in the chat box, and hopefully one of our reviewers can maybe just give a quick synopsis of that while we're in here as you get to it too. And if we need to, we'll always get back to you. If we don't answer your question directly, I should have said this earlier, we will follow up with you within about a day or so. We keep track of the chat box, and we follow up with clients right away to make sure that we've answered your questions. Karen, the floor is yours to talk about the accreditation process.
Excellent. Thank you so much, Lisa. And thank you for the questions that you're putting into the chat box. Before I get into the accreditation process, one of the things I want to touch on is actually looking at our programs and how we look at our programs. As you heard Dr. Griffin explain, we have a lot of programs that we have within our purview. And one of the things we do is we do update our programs. And the questions around what Lisa just shared with me is interested about core and foundational focus areas. When do we do those types of things and when things are coming up? Organizations who may have multiple programs may have an opportunity where there is a disconnect in which they're in the old structure, which we call the core, or they have moved in and they've moved into the foundational focus areas. I think in the chat box, one of the questions are around DMCM, HUM, and Health Network. Just so you know, Health Network and HUM have been updated to have the foundational focus areas. In 2022, URAC is going to be working on disease management and case management, that's that DMCM, to update those programs also in 2022 so that they'll move from the core standards to a foundational focus. As we said, we streamline our standards. We look at how well to present them to you, the clients, and to understand them a little bit better. And this foundational approach is how we're moving all of our programs to that. So that's a little bit about program development, but if you have any additional questions, just go ahead, put it in the chat, and we can kind of address it. So let's talk a little bit about the accreditation program. As you see, there are 5 phases within the accreditation program, and this is what we are going to be talking through as we go through this next part of the presentation. Next slide, please. So when you sign that AAA, that contract between your organization and URAC, one of the things you're going to get is a client relations. Here is all the client relations. One of these individuals will be someone that is assigned to your organization. This is the individual that you have the opportunity to reach out at any time to ask questions about the process, where you are, what's happening, questions, those kinds of things. And later on, Joe is going to give you resources that will be able to talk a little bit more about the things you can also do as you work on your application. During that application, that first phase is you working on your application. Next slide, please. And this is where we are looking for you to work on your application. I also saw some comments about how do you submit the right documentation? How do you know what to submit when you look at your application? Every organization is given a program standards guide. So every program that you are going for, so if you're going for specialty pharmacy, if you're going for health utilization management, you are going to get a guide, an accreditation guide or a certification guide, depending on the program. Within that guide, there are demonstrations of compliance on desktop and demonstrations of compliance on validation review. This gives you an indication of the types of documents that we are going to be looking for in your application. So when we look at your application submission, you will give us information about your organizational structure, how you do business, what do you delegate, if you delegate any at all. Do you not delegate anything else, any standards at all? This gives us an idea of who you are as an organization. And then what you're also going to do, that documentation that you're going to be submitting is going to be policies and procedures, it's going to be minutes, it's going to be reports, it's going to be templates, it's going to be snapshots of how it is that you actually do your business. For each standard, the expectation is when you go into AccreditNet is that you are citing where it is that we're going to find that compliance. So always remember, organizations can upload program documents. They can be 20, 50 pages, but you have to tell us on what page, in which paragraph, we're going to find that information. If you do not put the citation, the lead reviewer will send that information back because they cannot find that information. So always remember to cite where we can find the compliance to the standards.
Karen,
Next,
before you go
yeah,
on to that next slide, let's talk a little bit about versions and when people apply, because I think there's a little
mhm,
bit of confusion here about, well, wait, if I'm accredited under core, but you're moving to foundational focus areas, it kind of depends on where you are, where the program is when they're up for reaccreditation. Can you just go into that a little bit?
absolutely. Thank you so much for that question. So suppose you're in one of the older versions and you are still in the core program. You will stay accredited within that program. So URAC accredits or certifies organizations for 3 years. Within that 3 years, and we'll talk more about that compliance, you're going to be compliant to those standards. If you are coming up for reaccreditation and we have revised that program, what happens is then when you interact with your client relations manager, you will now be moving into the new version. And so all of that information will be submitted to you. So in your old version, you might have core, but in your new version, you might have foundational focus areas. Now, some organizations do have some issues around that in that, well, what happens if they're new standards? What happens if they're the same standards? How am I going to be compliant from the old version of a program to a new version of a program? So here's a small way that you can remember it. As an accredited organization, URAC expects that you are compliant to all your standards over the last 3 years. When you have a new program, within that new program, there may be standards that have not changed. There may be standards that have been added, or there may be standards that are revised. Lead reviewers know which standards are unchanged, which standards are slightly changed, and which standards are just new. So the amount when we come in and do an investigation or when we do the audit, we are going to be looking for compliance depending on when you submit your application. So for all those standards that have not changed, the expectation is that you will remain compliant to those standards over the last 3 years. For those standards that have changed or new, the expectation is that your compliancy will start the day you submit that application. Hopefully that answers that question. And if you need any additional, please again, just shoot it in the chat. Next slide, please. So let's talk about the reviewers. As you can see, there are care management reviewers and pharmacy reviewers, and we have quite a number, and some of you may know these individuals and have had an opportunity to interact with them. Next slide, please. So once you submit your application, it goes in what we call the desktop review process. It is during this process that a lead reviewer is assigned to you, and then that lead reviewer is going to review your application. So they'll open up your application and look at your program documentation that you submitted and see if you have provided the information that was required. They're looking for a demonstration of compliance to every standard within that program guide. So they go to one standard, they've gone through, they've read your documentation, you've had your citations, they're able to see where it is that you have demonstrated compliance. They're going to mark that as met. Woohoo, thumbs up, we move on to the next standard. They go to the next standard, the same, it's met. They go to the next standard, and all of a sudden they're reviewing through your documentation, and they see there's an opportunity for you as an organization to provide some additional clarification, additional information that will demonstrate compliance to that standard. What that lead reviewer will now do is mark that as not met, and they will have what's called an RFI or request for information. Once they have gone through your entire application is when they will push that back to you so you can see where it is that there is an opportunity for you to provide us with some additional information. This back and forth, this iterative process is what we call our iterative learning process. Because here it is where you and URAC are having the opportunity to see where you can help to improve your documentation to demonstrate compliance to the program standards. Next slide, please. Once we've gone through that iterative learning process, RFIs are done, the desktop is now closed off, you now move into what's called the validation review. And I remember one of the sticking points for some people is that on-site validation or that virtually validation review. So here's some tips for you to learn about as you do a validation review. The lead reviewer they're going to provide you with an agenda. They're going to tell you exactly what it is that they're going to be looking for. They're going to tell you about the individuals that they're going to need to do the interview. They're going to tell you exactly what they want to do. So when they come on site, you will know who it is that they want to do the interviews. You're going to know when it is that they're going to do the observation. So if you're in a specialty pharmacy and they have an observational look, we're going to tour your facility. Even for HUM, we're going to tour your facility. One of the things you want to remember is the desktop review provides us with information on how you do your processes. The validation review tells us how well you have implemented those policies and procedures that you provided on desktop. And it is now, this is how you are doing business. So those are the types of things that we're going to look at. We're going to do the documentation review, as in looking at contracts, especially for those that are doing delegation and those who are using vendors to do certain types of activities within the scope of the accreditation or certification. The next thing that we do is, once that validation is completed, we're going to have a closeout with you. You're going to know before that lead reviewer has left where it is, if there was any items that we saw that needed some improvement, or if there was no findings at all. We're going to close your application. We're going to blind it. And then we're going to create what we call the executive summary. That executive summary is the information that we send to the accreditation committee. Next slide, please. So the accreditation committee is the voluntary body for URAC who provides every determination on every application that goes through URAC. It is their responsibility to provide organizations with one of 5 potential decisions: full accreditation, conditional accreditation, corrective action, denial, and provisional. Full accreditation, conditional accreditation, and provisional are all accredited statuses that allow an organization to be put on the web. In other words, the URAC directory. If you have a corrective action or a denial, those statuses will never be shown up on the directory. You will find out your status by a decision letter that the directors of the pharmacy or care management will send to you to let you know exactly what the accreditation committee has rendered on your application. If you fall within those 3, you will get an official seal and the official certificate that's sent out are only for organizations that fall within the full range. But you will get a seal and you will get an electronic certificate that allows anything that falls within an accredited status. As I spoke about the directory, every organization who is within an accredited status will be put on the URAC directory. Now, when we talk about appeal rights, we always give organizations an opportunity if you're less than full. If you fall into conditional, you fall into corrective action or denial, that is a less than full status. We provide you an opportunity to say, during that validation review, the lead reviewer, you may not have had an opportunity to provide us with additional information to demonstrate that compliance. And if you can provide it on appeal, then you have 30 days in which you can do that. All appeals are submitted to the Executive Board of URAC for adjudication. Next slide, please. So once you are accredited, in an accredited status, we expect ongoing compliance. That's that 3-year that I spoke about early. The expectation is that you will always remain in that accredited status and you will always maintain compliance to the standards. Measurements is a part of that compliance. If you're in a program that requires measurements on an annual basis, when the notice goes out that you need to submit measures, the expectation is that you will submit measures. Remember, measures are a mandatory standard. And if measures are not submitted, that will cause your application to go back to the accreditation committee for a determination on your application. Submitting measures and demonstrating is a part of demonstrating your compliance. You also, as an organization that is accredited in URAC, may be selected for what we call our random monitoring cycle. We have a process to where we select a certain amount of organizations in which we will come in and do a random monitoring to see if you're still compliant. This is of no cost to you. You will be notified of this. The lead reviewer will call you and say, we have a monitoring review that we have to conduct, and let you know and give you that time. That is the only time that you're ever notified of a monitoring review. For a for-cause review, those are because of a grievance or issue that came up where URAC will tell you the day before that we would be on site the next day to do a monitoring review, a full validation review. The expectation again is that you remain compliant during your entire award cycle. Next slide, please. So here on this slide, just wanted to kind of provide you with some programs that have measures so that you know telehealth, we have that on there. There are no measures as yet, that's being worked on. So as you look at these slides, you will know because part of your contract will include a measures piece. Next slide, please. So I will now turn it over to Joe, unless there's any other questions, Lisa.
Karen, there were a couple of comments that came in through the chat, but I want to recognize that every client situation is a little bit different. So we're going to follow up with them. I know there's some people who need some materials. A huge thanks to our reviewers that we have in the room for answering questions. So we're going to get in touch with you and we'll make sure that we get all of your materials. Like I said, we follow up within about 24 to 48 hours. So with that, hopefully Joe can come on over, answer some questions, talk to you about the resources that we have.
Yeah, thanks, Lisa. As I see a lot of familiar names in the chat and participants, I'm excited to talk to you guys. I'm Joe Costello. I'm the Director of Client Relations. I've spoken to many of you via email and stuff, but now hopefully you guys can see my face. But I'm here to talk about the resources that we have, not just the people, but other things we have to make your experience a little easier. We know it's a big lift, and we want to make everything as smooth as possible for you. So, Lisa, if you want to go to the next slide. So Dr. Watts mentioned that we have a great group of people that are here to support you, including myself and Dr. Watts and our directors, but we also have the client relations managers. They are your first point of contact throughout the process. They will get you what you need. They'll put you in the right position. If they don't know an answer, they'll get it for you. As Dr. Watts also mentioned, we have a great team of accreditation reviewers who will help you through the review process. And one group that's not on here that I also want to mention is our IT help desk. Many times there's questions that either the client relations managers or the reviewers can't answer, but it's an IT related issue. Our IT team is super responsive and they're super helpful, and they're always willing to help a client if it's an IT related issue as well. But some of the other resources we have, which you can find in AccreditNet in your documents library, which my colleague later, Maggie, will go into. But you can find your AccreditNet guide. That's going to teach you how to operate the application system, how you can upload your application for review. Additionally, your program guide. Many of you have seen the standards at a glance. Once you sign your contract, you get access to your program guide. That is going to be your Bible throughout the process. It's going to teach you, it's going to go into more depth about the actual program. It's going to show you how we want to see the documents uploaded, what documents are important, and just a broader description of all the standards for you so you know what you're looking for. And the next tool that we have, which is really, really, really cool, is our Client Information Hub. It says Client Portal. We did change the name recently, but to Client Information Hub. This is your first stop once you sign up to go through the accreditation. This is going to have all your resources. It's going to reiterate the process. You're going to have glossary. If you don't know what a word means or you don't know what URAC means, meaning of a word is we'll have a glossary on there. You can meet your team. You can have, there's helpful videos on how to operate AccreditNet, how to do different, how to read your guide, things like that. We're going to be adding stuff. My team, the client relations managers, are going to be putting together little videos of how to fill out your master information form. I'm sure many of you have all had to fill that out and had some questions, things like that. Additionally, we have, there's like I said, there's a lot of resources. It's also going to have links to every single one of our other resources. So you're going to have your link to AccreditNet. You're going to have a link to our interpretations portal, which I'll get into in a second. But it's also just a good place. We also update it with news. So if you want to know what's happening at URAC, every month there's going to be a little section that's going to tell you what we're up to. Any changes is going to be put on there. It's kind of a way to, you don't always have time to reach out to a client relations manager. You just want an answer quickly. The goal of the Client Information Hub is to provide that information at your fingertips. Lisa, do you want to go to the next slide? So one thing that we have on the Client Information Hub is the standards in 6. The standards in 6 are these, we were talking earlier about how we went from core to foundational focus areas. These are little videos that were put together by our review team, and you can watch them and they'll give you a little bit of a background on how we want to see these new foundational focus areas, and each of them are no more than 6 minutes long. So you're getting a good description of what this new standard is, this new foundational focus area is, from an expert, one of our reviewers, in less than 6 minutes. It's really, really helpful. There's been a lot of positive feedback from those who've already taken advantage of these. But so I encourage you, like I said, to, after this meeting, after this webinar, if you haven't yet, check and see if you have access to the Client Hub. If you don't, please reach out to your client relations manager. We can reset your password. We'll get you in there. I know there was a question earlier from someone who was wanting to know who the client relations manager rolls up to. So that's myself. I have your email. I will be happily reach out to you after this. Additionally, I offer myself as a resource. If any of you have any questions, please reach out to myself. I'm here for you to answer questions. Most likely the client relations manager can do it, but sometimes you need want to speak to me as well. So Lisa, you want to go to the next slide? So here's something that we've had for quite a while, but I always want to bring it up again. Our interpretation portal and our inquiries. This is in AccreditNet, and actually, it's on the Client Information Hub. But this is where if you have a standard related question, you submit that to the interpretation portal. The reason why we have you submit it through this, it's not just through an email, is one, if you have a question, there's a good chance that someone else does too. So we want to make sure that we can track this and see, make sure that we're designing our programs correctly, and if we are providing answers in a standardized way. Additionally, other information about this, these are reviewed by the reviewers. I'm not a clinician. Sometimes you don't want my answer when it comes to a standard. In fact, the client relations managers are not going to give you answers on those standards because, again, they're not clinicians. So this is where you want to go to get those answers. We ask 3 to 5 business days is the usual turnaround on that. Lisa, I think that covers everything that I have.
Joe, that is it. And we realize you're going to have 2 passwords for URAC. It's partly part of, hopefully part of our growth at some point, but right now you'll have your login for the client portal. You can go to clients.urac.org. It's actually really easy. Put in your email address, click forgot password. You'll get a link you'll be able to reset your password. You'll get a link to reset your password. If it doesn't recognize your email address, you will be able to just talk to your client relations manager. And can we have multiple staff able to log into the portal? Yes. Joe, this is all you.
Yes, absolutely. There's as many people as you'd like in the Client Information Hub. Reach out to your client relations manager. They'll make sure all those people that you want have access. They can take care of that for you. I know I mentioned it earlier. a good thing to do is right after this, check and see if you have that, you have access. You want to make sure you can get in there as soon as possible, because I think it's very, very helpful. We're pretty proud of this. I think it's going to, and this is, we're going to keep building on this. This is going to be, we're going to add things to it. There's going to be, we have a lot of goals for this, so we're pretty excited. So let me, and there's also a feedback section. So please, if you think that there's something that we could add to it, do that too.
Yeah, Joe, you and I know work on this pretty closely together, and we launched it about 6 months ago, and now we're starting to think about what's the next phase. So I hope you'll really love the standard in 6. All the reviewers who are on the call today have actually recorded a standard in 6. And I promise you, not a single one of them is longer than 6 minutes. Most of them are about 2 to 3 minutes. So I see a lot of great questions coming in. Just know again that if we're not answering them right now, we'll follow up with you in the next few days. I want to bring off Joe. I'm going to ask you to go off camera. We're going to bring up Maggie Cornett and ask her to come on camera to talk about AccreditNet. And let's just say, Maggie, caveat here, you're not going to go into a lot of detail about AccreditNet because we've got some upcoming trainings on that.
I will not go into a lot of detail. Hello, everybody. My name is Maggie Cornett, and I'm the CIO at URAC. We actually went live with AccreditNet 3. We started going live with a pilot in December of 2020. We went live with all programs in March of 2021. So a lot of you will be accrediting in AccreditNet 3. There may be a few still finishing up in AccreditNet 2, but for the most part, you're joining us with AccreditNet 3. Next slide, please. So what you need to know, first and foremost, is that your login, the very first time you log into AccreditNet 3, you're going to need to set up a password. And the way to do that is to select the can't log in or forgot your password link at the bottom of the AccreditNet 3 login screen. Armature, what is that? Armature is actually the vendor that supplies the application. This is an off-the-shelf, believe it or not, accreditation application. That's pros and cons. It means that we have a vendor to support us. It also means that we are still in the process, because we only went live about a year ago, of refining that application to really, really meet the needs of our organization. So you're going to continually see refinements to the application. We will have another one at the end of May, beginning of June. Typically, there's a monthly rollout of new functionality, so stay tuned. But anyway, the first time you log in, you'll hit that can't log in or forgot your password. It'll send a link to you to set up a password for your AccreditNet 3 account. Your login is always your email address. Next slide, please. Okay, after you log into the system successfully, you'll see a small pop-up that asks you if you want to log in as with my items or as an organization representative. You're always going to choose organization representative, and that'll take you to a screen that lists your organization and any sites that are there for your organization. Then you want to select your organization's name, and that'll take you to this home page. Because the home page is a little busy, what I've done is I've numbered the different sections. You'll notice that each section is mirrored in the tabs across the top. So for example, application, section 3, on the top, you'll see applications as a tab. Notice of change isn't mirrored, but the instrument, the scheduled items, item 5 is also across the top in the tabs. So just a little background on the home screen. Section 1 is the overview. It should have your organization's main address, should have your primary POC's name and email address. It will have your liaison at URAC's name. Below that, item 2 are your current active certifications or accreditations that you're holding. If you're looking up something that you've held in the past, you simply unclick that show active only button right below certifications, and it'll show you the complete list of all the certifications you've achieved in the past, along with your timeframes. Applications, just a word about the difference between an application and an instrument. You're applying for an accreditation or a certification, but you're filling out an instrument that contains standards, and that's how you're going to demonstrate what you need to demonstrate to achieve that accreditation or certification. So a little variation there. 4 is if you needed to submit a notice of change, you would go to that section to submit the notice of change. And then finally, 5 is where the actual instruments are, your scheduled items. After you do your application once and just look at that screen to make sure it's correct, for the most part, you're going to go back in through your scheduled items and go directly to the instrument that you need to complete. What I'd like to do is just make a mention about one tab, and that's the Documents tab, second from the last at the top of the home page. So let's go to the next screen. The documents. Yes.
Can I interrupt? I'm going to
Please.
interrupt you because we know I do this. A little bit of it. We launched AccreditNet 3.0 a little bit more than a year ago. But is there any way where a client would know if they're 2.0 or 3.0 for AccreditNet? I think that's a big question, especially as people are going through reaccreds.
If they're going through reaccreds, they're going into AccreditNet 3, and your CRM is going to send you the link to get to AccreditNet 3, and you want to make sure you bookmark that link. If you started in 2.0, you've already received your link way in the past for that, or in the past for that, and you're in the process of completing your application. So for the most part, you're going to AccreditNet 3 for all new reaccreds, for all new applications. You still have access to AccreditNet 2 because folks want to look at the documentation they submitted the last time, and that documentation is still there. Okay, just a note about the Documents tab. Once you enter the Documents tab, there are actually 2 subsets under the Documents tab. You'll see the library in the right corner is the default. Library are those items that are very specific to you. So your certificates, your seals, anything would be uploaded into that library. The Shared tab are items that we've uploaded into the system once, but we share across a number of organizations. You're going to go to your Shared tab for your guides, your crosswalks, your measures information. So that's a very key place to know. And don't be confused if you don't see anything in the library, go to your Shared tab because that's where the documents that you're most likely looking for are going to be found. Next slide. So this is what an instrument page looks like. You'll see the application instrument is on that right side of the screen, starting with application introduction. And to move through the instrument or to start the instrument, you're going to click on the section and it'll take you right into the instrument. You'll have previous and next buttons. You'll have save buttons. It's pretty intuitive once you look at that, how to move yourself around in the instrument. One key point that I want to point out is that the POC for your organization is the only person that can submit. Once you've completed uploading your documentation that first time, you're going to hit that blue submit button to submit that instrument back to URAC, and that's our signal that you are ready for your desktop review. Keep in mind that you have a due date, and that submit button disappears once your due date is passed. So you want to keep in mind, what is my due date? And I want to make sure I can submit that application in time. Next slide.
Maggie, 2 questions in the chat box.
Yes.
Anything that somebody submitted in 2.0 does not automatically go into AccreditNet 3.0, correct? They are separate systems. Okay.
It does not.
And then the other one, I'm pretty sure I know the answer is, can documents in one standard, like if I'm submitting for both case management and utilization management, can documents be linked or shared, or do I have to upload a different document for each standard?
At this time, within an instrument, you can certainly use the same document multiple times. So within the CM instrument, for example, you can link that document multiple times. You don't have to upload it every time. You just link it once. But across instrument, we do not share documents. Not at this time anyway. It is perhaps an improvement we're looking for in the future. So you would upload the documents and then link those to those standards.
And remind me, how many people can have access to Accredit? And I know for the portal, we're happy to, for the client information hub, anybody can have access. But for AccreditNet, who has access?
Okay. The people that you need to have access to the instrument are usually identified by the POC, and multiple people can be in the instrument at the same time, with the one caveat. They have to be on different pages. So you'll see the standards listed. You see general questions, you see focus area, HWS dash, you see the next focus area. When you divvy out answers or people who are going to address the instrument between a number of folks. Make sure they are on different pages. If you're on the same page, the last person to save that page kind of wins. So you might have somebody uploading documents, they hit save, leave, but if somebody's on that page and didn't refresh, then when they save, they're going to overwrite and blank out whatever work was done. So multiple people can be in the instrument at the same time, they just cannot be on the same page.
Thanks, Maggie. Let's get to the fun part. After the fun part happens after everything is submitted, after the review is done.
Okay, once you achieve accreditation, you have access to your seal, and you go to your seal through, if you remember that home screen, the certification section. You click on your active certification and it'll take you to this certification overview screen. On the certification overview screen is the HTML code that you can copy to a clipboard, save it in a file, and send it to your webmaster so that they can upload it onto their website. And the code will actually work into the framework or the web frame that your webmaster has. So that's one of the nice pieces of this, is that you no longer have that whiteout around the seal. It'll actually be true HTML code that your webmaster will be able to utilize. At this time, we do not provide a print seal. However, if your marketing people cannot take the HTML and flip this to a print seal for you, for your marketing material, we are happy to provide one. Simply put a note into the AccreditNet, ask your CRM or call the IT folks, and we will be happy to give you a seal. Next slide.
Oh, Maggie, you know this isn't going to be that easy because we have a couple of questions coming in here. So first is, it's coming from Kelly. If you have 4 reaccreditations all going through the process at the same time and they all use the exact same documents, can you upload them once and then copy them to the other 3, or is each one an individual in application?
Let me phrase it this way, because you do have to upload them separately to each instrument. So that is the case. However, it does not have to be a 1, 2, 3. You can, if you've got the documents and you know they're going to be used across multiple applications, you simply highlight them all in your File Explorer and then drag them over and drop them into that instrument. And then you'll be able to link from those within the instrument. And I will talk about upcoming training in a second, and I will definitely demonstrate that during the training. So that's the next slide. On the second Wednesday of the month, starting in June, I'm going to be holding AccreditNet trainings for anybody who's new to accreditation, new to URAC, or new to AccreditNet 3. And we will cover how to log in. What does your homepage look like? Where do I find my documents? What do I look for on that application overview screen, and why are you sending there to begin with? What am I doing on the instrument? How do I find my seals? For those few folks that do the issuer information, we'll go through that. And then finally, how do I submit a notice of change and make sure that it's submitted correctly? And any other questions that you have. We'll also, as you have comments or questions, we'll take those at that time. We are refining the application as we speak, as I said. And we just love having your suggestions because we want to make this more user-friendly. One of the reasons we went from AccreditNet 2 to 3 was because it's a cleaner application. It's more intuitive. It's browser-based. So it's a little easier to navigate around, a little bit more intuitive. But for those folks who finally understood AccreditNet 2, I know we're turning you on your ear a little bit by throwing a new application at you, or a new system at you. And we're going to work with you through that.
Maggie, thanks so much. I'm really excited about doing that. I think we've heard from our clients that they need a little bit more AccreditNet handholding. So we are happy to answer your questions. Those trainings will be great for us. I'm excited about doing them. And yes, we are recording them.
Yes. In the meantime, please reach out to me or my staff. We are here for you and we love chatting with you. Thank you, Lisa.
Thanks, Maggie. I want to close out. We've got some upcoming webinars and ways to stay connected. So we're, in addition to doing our trainings, for you to make your accreditation process easier. We're constantly looking at how can we make sure that you're up to date on what's happening in the field. So we hope you're going to join us next Tuesday, Pharmacy Accreditation in a Changing World. So for the 36% of you who are part of our specialty pharmacy family here, come learn more about what we're doing to prepare for Specialty Pharmacy 5.0, our new pharmacy services accreditations. That's going to be all there for you. And we're going to be doing a presentation. Actually, Maggie and Sean, if you liked hearing what they had to say today, I hope you'll come hear them as subject matter experts. They're going to be talking about data and defense and protecting patient data. We are, yes, I see questions coming in, and Laura Wood is saying, yes, can we please go to chat in? You can register. We ask that you do register for an AccreditNet training session, please. Go explore the client information portal, submit your questions, send your questions to your CRMs. We will get back to you here. We are going to make sure that our communication with you is strong. We are trying to get better at that. How do you register for the 5.0 webinar? That is up on our website on the events page of the website. So hopefully Laura can chat that in, or one of our team members can chat that in again. You'll also be receiving an email about it, hopefully sometime in the next 24 hours or so. Thank you to our reviewers. Thank you to our speakers for being on here today. We've had some great questions. We have a bunch of you to follow up with, so hang tight, check your inboxes. Thank you to everyone for joining us today. And this officially concludes the webinar.